Hi, my name's Lee Matthews and I'm a physiotherapist, and this is Pilates Rehab Relax. So don't forget to click the like button and subscribe for all of my latest content, and that's things like Pilates routines, rehab videos and relaxation sessions. So I'm going to go you through some gentle knee exercises you can do in laying. And they're aimed at people that might just have had something like a knee injury, where if you're not able to walk very comfortably because it's painful and swollen, by doing some gentle exercises to maintain the movement, to keep the muscles strong that support the knee, then hopefully as you recover, you'll make a speedier recovery as that healing process takes place. The other group of people that this is a really useful video for are for people with age-related changes to their knees. So as we get older, we can sometimes get a little bit of age-related changes, wear and tear. We sometimes even call it osteoarthritis. But we know that some people have got those changes without actually even having pain or discomfort. And what we know for sure is that if you have got those changes, if you can keep the muscles stronger that surround the knees, so the ones on the front and the ones on the back, if you can keep the joint from getting stiff, then hopefully you'll get fewer symptoms relating to that. So whilst it can't take away the underlying wear and tear, actually if those muscles are stronger so they support the joint better, then you tend to get fewer symptoms like pain, discomfort, and you're more able to do your daily activities like getting up and out of the chair or going up the stairs. So have a go, work at your pace. I'm going to go through 10 of each of the 5 exercises, but you might only do 5 of them to begin with. You work at your pace. They're not intended to be extremely painful, so if you find that they're making you really sore, then you're probably pushing too hard, or you just need to start a little bit more gently to begin with. And I'd be aiming for you to progress towards doing these at least twice a day. If you're recovering from an injury, you might even do them 3 or 4 times a day, but 2 sets would be a good number to aim towards. But it might be to begin with you just did 5 of them and you just did it once and see how you feel afterwards, and then the next day progress on to doing a few more of them. So I'll take you through them gently. I'll give you some options, and you can make the best call of judgment for where you're at with things, but you're the boss in all this. So the first one we're going to do is bending and straightening the knee. We call that flexion and extension. So I'm going to bring myself into laying, and I'm going to bend the opposite knee. So my one that I'm going to do the exercises on is this one here, because the one that's closest to you. But by keeping the other knee bent during all these exercises, it just takes any strain off of my back. So we can bend and straighten our knee by sliding that heel along the bed, so my foot comes in towards my bottom, and then slowly back out again. So again, you work at your own pace, and it might be to begin with, you don't go very far with it, but you might find by doing a few of them, you slowly go that little bit further. There you go. So this is a nice warm-up exercise, and it's just lubricating the joint, is getting those muscles used to moving. That's nearly 5 there. There you go, that's the 5th one. So if you're only doing 5 of each of them, you can stop and wait for the next exercise, but for the rest of you can keep on going there. So ways we could make this slightly different: if you were struggling, you could put something like a carrier bag or a bin liner underneath your foot, so that would eliminate some of the friction there and allow you to move a little bit easier. So that would be one way of making the exercise easier. There are some other adaptations I'll show you. We've just got 2 more to do with this one, and then I'll just show you one other thing you can do with it. There you go, so that's our 10th exercise. The other thing that we could do with this exercise, if you've got something like a tray, so I've got a tea tray here, if you turn that upside down, and if you use something like a belt, then I can use that like a stirrup. So you could actually use this exercise, again, if you had quite a stiff knee and you were trying to recover the range of movement. One way we can do that is by using the arms to give a little bit of gentle overpressure there, so a little stretch, and then you can relax again. So we can adapt all of these exercises for how best to suit your circumstances, and relax there. So that was our first exercise, flexion and extension of the knee. The next thing we're going to move on to is one called static quads. So the quads muscle is the one that's on the front of our thigh here, and that's a really important muscle. And the way we're going to exercise this, I'm going to tense up the front of my thigh, I'm going to pull my toes in towards me, and I'm going to push that knee into the bed. So I tense and hold, 1, 2, 3, 4, 5, and then relax, and then again. So these are really important muscles for the knee, for keeping you supported when you're standing, and this is a great gentle way of keeping that moving. And what we're also doing here is straightening the knee joint. And again, sometimes we might lose that last little bit of the knee straightening. So by doing this as an exercise, it can help to maintain that range of movement. There you go. So that's the first 5, but if you're going to do the full 10, keep on going. Here you go. We're getting there. But again, each time I just tense and hold. 1, 2, 3, 4, 5. And relax. And again, push down and hold. And again. So again, for some things like wear and tear of our knee, if the knee has become slightly flexed there, you can even pop something like a small towel underneath the ankle so that when you push down, it gives it a really good stretch there. So again, that's an adaptation that your therapist might recommend to you, but if it was really irritable, then I wouldn't do that. But it depends what the aim is, whether you're trying to improve the range of movement or whether you're looking to build muscle strength. And I think the focus for a lot of you is going to be about getting that muscle strength, in which case we do it without the towel to begin with. Right, well that's our static quads exercise. What we're going to do another one for is the quadriceps, and it's called the inner range quad. So I'm going to use this towel that I've got here, a big bath towel. Again, you might use a cushion or a pillow. I'm going to roll that up. I'm going to pop that underneath the knee there. So my knee's slightly bent. Again, I'm going to recline backwards for this one. And again, pull your toes towards you, straighten that knee so your foot comes up off of the bed, and you hold 1, 2, 3, 4, 5, and down again. Well, you know the drill. 10 of those, please. I'll count out the first 5 though, just in case you're only doing 5. 1, 2, 3, 4, 5, and down again, and again. 3, 4, 5, and down, and again. So these are really useful muscles to train, because when we're walking, when you go to lift the leg out in front of you, when you go to step on the leg, these are what keep you supported. That's what's carrying your whole body weight. And it doesn't take long for them to get weak. So that was 5. Keep on going if you're going to do the full 10 though. Yeah, just, being laid up in bed for a few weeks with an illness, not being up and about over the winter time, those are all factors that contribute to making things like underlying wear and tear that might have been there for a long time and not even giving you any pain or discomfort, and then all of a sudden it can start to get quite irritable. So by doing that little bit of extra exercise in your day, that little bit of rehabilitation can actually make things calm back down again and make it a little bit easier to carry out your normal daily activities. And one more, and then we're done. There you go. So that was inner range quads. We're going to go on to an exercise called bridging now. So you might have seen some of my Pilates videos where I do something called the shoulder bridge, and that's very similar to this. So what I'm going to do, I'm laying down flat, arms either side of me, my knees are bent, feet flat on the floor, and I've got a small gap between my knees. And what I'm looking to do, I clench my bottom muscles and I lift my bottom off of the bed and I hold 1, 2, 3, 4, 5, and down again. So whereas the last couple of exercises were focused more on the front of the muscle, the muscle on the front of the knee, this is focused far more on the muscle on the back of the leg, so your glutes and your hamstrings, and down again. I've got a creaky knee as well. There you go, so that's our 5th one. And back down again. So sometimes people stir up things like low back pain by pushing too hard with this exercise. So when I go up and down, if you can lift your bottom off of the bed, that's great. But if you push really far with it, sometimes it can stir up the low back. So just work to your own abilities. And even if the bottom's not coming off of the bed completely, as long as you can feel those muscles are engaged, then you're going to get the benefits out of doing it. Obviously, it's better if you're going higher, but as long as it's not counterproductive and making you sore elsewhere. Okay, just a couple more. There you go, one more time. That's good. Right, that leaves one last exercise, and that's called the straight leg raise. So again, I'm going to lay myself down in a good position so you can see me. I'm laying down flat, I've bent my other leg, and what I'm going to do, I pull my toes towards me, push my knee into the bed, and I'm going to lift that foot up and hold it off of the bed for about 5 seconds, and down again. So this is the hardest of all the ones I've shown you today, and it might be that this one's a bit difficult. You might only do a couple of them to begin with, but get used to the others first of all if you're struggling, and build towards doing 5 or maybe even 10 of this one. As with all of these muscle strengthening exercises, we need to hold and sustain the contraction to get the full benefit from it. And down again. There's ways we can make these harder as well. You could do more repetitions, you could hold them longer, you could add weights on the ankle. There's lots of different things you could do, and relax. So that's the first 5. Keep on going if you're going to do the full 10. And hopefully by the end of all of these, you'll have a muscle like a rock on the front of your thigh there. Three more, and then we're done. And one more. And relax. And that's it, guys. So there you go. That was the gentle knee exercise in laying. From a rehabilitative point of view, where I'd be looking to go with this is as soon as you're comfortable doing those and it's safe to do so, it would be far more functional to do exercises in seated or standing. Any sort of exercise in those positions is going to be more close to what we're trying to get back towards doing, like walking or getting out of the chair and stuff. So get good at those first of all, and if you find that they get easier, if you're managing okay, it might even be you progress on to doing some of them in seated or standing. And what I'll do is I'll put some links to a video after here for some slightly more challenging exercises, and I've also recorded one to improve things like your balance and walking, so maybe I'll pop a link up for that as well. So hope that was okay, and thanks for joining in, and see you soon.